All right. I see Senator Jennings is in his National Guard gear today, joining us on command. Madam Speaker, are you able to hear me?
Yes.
Excellent. Excellent. All right. Are we ready?
Okay.
Do you want to kick us off today?
Okay. All right. Good morning, everyone. This past week has seen the worst COVID day in our state on Tuesday. We had with 40 deaths. But in spite of that, I feel that we are flattening the curve. Every death is one too many, but we need to keep up our vigilance so we can reopen the state as soon as appropriate and get our residents back to their lives and our economy back to work. This work group continues to be an important part of communicating with the public and providing oversight and support to the administration. I hope we can continue to work in the spirit of bipartisan for the people of Maryland as we come into the most urgent weeks of the battle to date. And thank you everyone for your participation and comments that you have given even when we're not meeting. It's been very helpful. Mr. President.
Thank you, Madam Speaker. Another beautiful day in the neighborhood here, the stay-home order, and certainly been a really tough week this week with the peak seemingly, or the projections all being this week. And we have a pretty packed agenda today, it appears. So we're gonna move through it quickly, but we have some really folks that are on the front line doing some of the heavy lifting here to manage the crisis here in Maryland. A couple of the quick updates of things that have popped up this week. We received the responses from the Department of Health from last week, the written responses, and those have been submitted and should be emailed out to the work group. We had one executive order on the execution of wills, power of attorney, and written advance directives, which allows for remote witnessing. And so this is an issue that the legislature has taken up in the past, but now the executive order will allow for that remote authorization. Some updates with the unemployment insurance, additional staffing. There are now an additional 150 employees assisting the department. Hopefully members received the updates from Commerce, the applications and some of the updates on the money being distributed from the state funds. We had the chief judge discussing the release of at-risk incarcerated individuals and pretrial release of individuals, as well as detained and committed juveniles. And then lastly, the Board of Education just yesterday put forward some more regulations related to graduation tests, the annual assessments, and the service learning hours. So, every week there's a whole set of changes that are kind of popping out. The speaker and I have been closely communicating to try and make sure that we get information out to members so that they can distribute it to the public as quickly as possible. And so, this is quite an evolving situation, and everyone is adapting, and just really appreciate everyone's work. I know everyone's been working incredibly hard, kind of harder than ever. It's like a sine die every day with the constituent work that's come up for folks. So certainly stay in touch as things continue to move forward. I believe we have the Health Care Commission.
Give them one more minute, Mr. President.
Okay. Other updates, Madam Speaker, any other updates as they
other than, I know I've been getting a lot of calls about the unemployment insurance. And I think the Commerce, I've been sending them that email that we got from them. So I think that's helpful.
Yep.
So,
Do we have Department of Health, Jake? Do we want to switch the order around?
No, we just resent the link for HSCRC, so they should be on in 1 minute.
Okay. Well, I hope everybody's staying healthy. We'll hope that they join us momentarily.
I see, can I ask Senator Smith, you have any update on our prison situation? I can see you there.
Can you all hear me?
Yes.
No, apart from the guidance the court released yesterday, no other updates apart from the two letters that the chief judge released yesterday. We've been in contact with them. The Judiciary Committee and JPR sent a letter to Secretary Green asking for some of the steps that they've taken to ensure that we balance public safety with the well-being of our incarcerated population. And they sent a letter back that it kind of enumerated kind of the proactive steps they've taken, and I can forward that along. It's fairly lengthy, so I can forward that along to the rest of the committee if they think it would be useful.
Yes,
That'd be great.
that would be helpful.
Do we have HSCRC available?
Trying to figure that.
Motion detected at the doorbell.
They are still not on. I know Jeremy is trying to get them now.
I also just realized that I've been saying HSCRC instead of the MHCC. My apologies. The acronym game has. All right. Looks like we have Megan. Are you joining us today with?
I am, but Ben and our executive director, Ben Steffen, and Andrew Pollock, our chairman, I'd prefer to double check to see where they're at.
Great. Well, one of the beauties of the stay-home order is the Zoom adjustments. We're all learning it on the fly, and the logistics. We have it down pat in session for hearings and meetings. The remote process is a work in process. Madam Speaker, I see that Delegate McIntosh has her hand raised.
Oh, okay. Delegate McIntosh.
Thank you, Madam Speaker, and thank you, President Ferguson. He was just mentioning how we're adapting to Zoom on the fly. This group should know that the Appropriations Committee did the first Zoom committee meeting last Thursday. And speaking of adapting, I lost power. Electricity went out while I was chairing the Zoom meeting. So that was fun. At least the power hasn't gone out on us today.
Well said. All right, we are still trying to find a way to get them in, apparently. Any other updates from other members while we were waiting?
Or questions?
Senator King?
Did you get that?
Nope. Oh, now I can hear you.
I just wanted to wish you a very happy birthday.
Yes.
Oh, thank you.
Oh, yes. Happy birthday to you.
Thank you. There's nothing more I would rather be doing than a Zoom call
Absolutely.
while quarantining after being a kindergarten teacher in the morning. No better way to spend my birthday today.
So they're having technical difficulties, so they're going to call in instead of Zooming in, but give them a second and they'll be on.
Okay. Do we have Department of Health? Is Department of Health available?
Not yet.
Okay. Madam Speaker, it looks like Delegate Lutke.
Delegate Lutke.
Thanks, Madam Speaker. Mr. President, you mentioned a second ago the State Board of Education meeting yesterday. I had heard some rumors, but hadn't seen a final statement. So they waived all the graduation test requirements for this year's graduating class. Is that correct?
That's my understanding.
Yes.
Okay. And the student service learning requirements as well or?
Yes, I heard that as well. Yes.
Okay, great. Thanks very much.
Mm-hmm.
Senator Griffith. All right, Jake, there we go.
Good morning. And yeah, let me join in the happy birthday to the president. Good to see you, Madam Speaker, and to all. I understand, and for those of you that haven't checked your bank account, some of the individual stimulus checks are being received for our taxpayers. And I'm wondering how, and this may not be an answer for this call, but if we're getting a sense of the timing of the flows from the CARES Act to our agencies, because I understand there is some delay in the funding actually reaching the agencies in areas pertaining to Medicaid, Medicare. And I also wanted to just raise, I received some calls yesterday about the foster care folks and some concerns they have. And so I just wanted to get those on our radar.
Thank you. Those are, yep, let's add those to the list as well.
And
right.
We have them on now, Mr. President.
Excellent. All right. So we have Andrew Pollack, the chairman of the Maryland Healthcare Commission, Ben Steffen, executive director, and then Megan is here to assist with questions. So our timing is going to be a little bit tighter. So we're going to have to speed it up just a bit if the presenters could just keep that in mind as they move forward. And if we could, can we double check that we have, do we have Dr. Pollack on the line?
Ben is on. We expect Dr. Pollack to be calling in a second. I believe Ben is there.
All right, Ben.
Yeah, Dr. Pollack asked me to proceed. He had a conflict at the hospital, so he may be joining. I'm going to go through the presentation that I sent you. I can't see you, but I want to wish the president a happy birthday. And also, I appreciate him providing his social security number as the meeting password. I'm sure some of us will find that useful as we go forward. Quite a long password to get in. So the Healthcare Commission has a small role to play in this mammoth effort to address the pandemic, but I wanted to give you a brief update on what we're doing. Our role principally follows in our traditional role at the were it not for a pandemic, in that we are responsible for health planning, work closely with the HSCRC in the total cost of care model, and facilitate the adoption of health information technology in the state, among other activities. So I'll move to, let me start my slideshow here, to the second slide. And that's just a quick screenshot of the Commission's page addressing the coronavirus. It includes information on what is key to our response, which is emergency CONs. It provides guidance on how healthcare facilities, hospitals, and nursing homes in particular are to address address the challenges going forward. And it also provides some information on how we are scaling back some of our oversight activities pertaining to cardiac surgery and PCI. You know that largely as stenting or angioplasty. And lastly, it provides some guidance on telehealth. One thing that pandemics and emergencies do is encourage people to try different things. And we've seen a surge in telehealth, interest in telehealth, and interest on the part of consumers in telehealth. I recently had a e-visit with my urologist. It was the best visit with that particular physician, I must say, I've ever had. So let's go to slide number 3, which is really, I think, the key point of the commission's responsibility, and that is for their facilities. And one thing that I really want to emphasize is that the Office of Healthcare Quality and the Maryland Healthcare Commission are working together in a streamlined manner as never before. We agreed in March on an approach which would focus on speedily adding capacity, focusing on expediency, gathering documentation for what certainly will be a look back after the pandemic is resolved, and also a desire to use our existing regulatory authorities so that no additional regulatory or even governor's executive orders would be needed to bring on this new capacity. For hospitals, the OHCQ and MHCC decided that in terms of how we were going to approach this, the key discriminator would be, does the proposed space contain hospital bed walls and attachments for medical gases? Typically what that means is that space was at one time a hospital bed, but as we have downsized hospital inpatient capacity over the last decade, considerable capacity has been taken out of existence, but the head walls and gas attachments oftentimes are not removed. So if the answer then was yes, OHCQ, under its existing temporary licensure authority, would go forward and license that space for the duration of the state of emergency, plus 30 additional days of leeway. Again, this is temporary authority, and typically during the course of a year, OHCQ would deal with this with requests for temporary expansions of license due to a flu epidemic or some closure of another facilities wing in a different jurisdiction. So they were well familiar with how to do this, but what they prepared to do was do this on a mammoth scale. If the answer then was no, that this had not been previous inpatient bed space, previous post-anesthesia treatment areas, or areas of the hospital that had hospital bed head walls and medical gases, the alternative would be that MHCC would issue an emergency CON, which the Healthcare Commission had a long time ago established authority to issue an emergency CON in anticipation of fires or floods or situations in which a specific hospital had an emergency in which it had to expand authority. And I, as the executive director, after consulting with the chairman, could do that, with the decision then coming to the commission for confirmation at the next regular meeting. That's been a very effective way moving forward, and in particularly during the period between the 25th of March and about the 5th of April, we considered and approved approximately a dozen emergency CONs that together added about 850 rooms of hospital capacity in the state. OHCQ, as of last weekend, the 12th of April, had added an additional 1,500 beds. And that, I think I want to emphasize, it does not include the Baltimore Convention Center or other alternative care sites that are currently being considered and positioned around the state. So just in terms of what is a hospital head wall, and it's typically when you go into a hospital room, you would see the area in front of the hospital bed in which electronics, medical gases, monitoring equipment could be attached. That we felt was a key discriminator in terms of whether we could quickly, through the OHCQ authority, relicense hospital capacity. And as you've seen, over 1,500 beds have been brought online as a result of that. So how did we do this, and how did we communicate to hospitals? I think we pointed out at the start that we have a commission website specifically with information pertaining to the coronavirus response at MHCC. We issued a guidance which was communicated to hospital executives via email as well, laid out this particular provision and spelled out the alternatives for them. The site-specific CONs, we've been able to move forward and turn around on about a day to day and a half basis. And that involves, we really don't go through an extended CON review, assess need, assess financial viability. We do not consider those standards for an emergency CON and believe we can move forward quickly with that. As noted, most of the beds that have been brought online, both for OHCQ, relicensure, and emergency CON, are committed to being brought online in the late April to early to mid-May time period. One thing that we realized after we got fairly far into this process is that rather than calling them or relying on other information sources to determine that yes, indeed, these beds were really brought online, our recent orders have required the applicant to notify us when the beds are ready for operation. That simplifies it and means we don't have to call back and check on at a facility that these capacities are brought online. Now, I think the question is,
could you please, sorry to interrupt, Jake, could you go back one
Sure.
slide? Thank you.
One slide?
Yeah, he was a little bit ahead of you, Ben, so you're perfect now.
Okay.
Yep.
So, yes, so the, this is just a picture. Sorry, I forgot that you couldn't see my screen. I need to point out the slide number. So 4 is just a picture of what a typical hospital head wall would look like, and why we are saying that if a hospital room continues to have a head wall, that can be relicensed temporarily, immediately through the OHCQ mechanism. The logic there is that head wall means that gases, electronics, monitoring equipment can be attached and plugged in. A hospital bed itself and some equipment, some durable medical equipment may be needed to be brought back into that room, but there doesn't need to be significant construction, et cetera, for bringing it online. On the other hand, if there is no head wall, that would be a case where significant construction may be needed, and sometimes it is, sometimes it's not, but it's a discriminator which we thought was very clear to hospitals on when and these emergencies. Up to slide number 5, just to outline the emergency CON process. We did communicate this initially on the 21st, made some revisions regarding some additional reporting we thought were necessary, clearly defined that if the rooms that were to be brought online had already had head walls, no CON was needed. If they did not, they had to go through this process. And we've been able to meet this emergency process pretty efficiently. Typically, from the time we receive a letter to the time we issue an order for an emergency CON, about 24 to 36 hours will have elapsed. We were approving a CON last night at about 10 o'clock at night on a request that had arrived earlier in the day. So we really are very serious about doing that. In total, issued 18 emergency CONs, again, brought on most of these beds. The facilities are committing to bring them on in April and May. Some will be moving out as late as July. But given the uncertainty of when the peak will hit, we felt as though it was warranted in two cases to issue these emergency CONs. And even if we are beyond the apex of this wave, we all know that we are not going to be completely free of this pandemic or this virus until a vaccine is found. And so even as we're trying to deal with wave one, we need to be thinking about wave two. And our thought is that even if they are not needed at this stage, in the fall, when we'll have a full 6 months potentially of winter months when the virus could spread, that indeed we may need these beds even then.
Mr. Stephan, this is Bill Ferguson. If you could, we only have a few more minutes, and it looks like you have a couple more slides. If you could hit the high points so that we can have just a few questions.
Sure. And so I think the one point I wanted to make about what we've learned in this process is that hospitals are prioritizing establishing space close to existing facilities. They need to bring physical bed space on first. That's the simplest and it's least costly. Then they're repurposing space in a hospital. Then they consider adjacent MOBs and other buildings. Then they're considering these field hospitals. We call what some call tents, field hospitals. And then several are moving back into operations. The big challenge is, I think, remote sites. We may need them, but they're tougher to do, not only for the facility management, but for staffing as well. But they need to be considered, if not now, but for wave two. I think you've heard quite a bit about nursing homes, and I'm not going to touch on that other than to say that we are aware and are working with OHCQ on the complexity. And then on our telehealth efforts, we are getting approximately 30 calls per day from consumers and providers about telehealth. We have a significant outreach to them and are engaging webinars. And the significant thing is what we are going to award a grant to 4 not-for-profit organizations to help us bring community practices up to speed in delivering telehealth going forward. I'll conclude with that. We're a number of other important activities we're working on, scaling back some of the reporting temporarily, but given the time, I'll be happy to answer any questions.
All right, and we do have a couple. The first from Delegate Jackson.
Good morning. Thank you, Madam Speaker and President, and thank you for the presentation. A couple of quick questions. Primarily, since this is not a one-off, the expansion of their activities, could you briefly discuss, or you can submit to the Workgroup, manpower considerations going forward?
So, I think that's a really important question. And if we were doing an operations research study, it would be my opinion that that staffing is on the critical path. We're not directly involved in this, but I will ask our colleagues at the Department of Health what they can provide to you. But I think you've hit something that's going to be key. We can put these beds in operation, but we have to have people to operate them.
Looks like we have a question from Senator Lamb, and then I think we're going to have to move on after that. I'm sorry for the rushed timing, but we will follow up with questions in writing afterwards. Senator Lamb.
Sure, thank you. Just a brief question for Mr. Steffen. And I'm not sure if you touch on this or not, because you're focusing seemingly on most of the certificate of need part of this. But in New York, when the Mercy or the Comfort was brought up there, initially they thought that these hospitals that were being stood up there and at the Javits Center were mostly going to be focused on non-COVID patients. Now they've had to redirect and bring in COVID patients. That's led to some challenges with, how those types of facilities were staffed out, and also what was available at those facilities. Have those thoughts been processed into your workflow and that process there, and how these facilities are being stood up, or is that addressed somewhere else?
So in terms of the alternative sites, that is a matter of ongoing discussion. I'd encourage you to contact Mr. Schrader, Deputy Secretary Schrader, on that particular question. We are most focused on that as it pertains to the nursing homes. We do get information from nursing homes on the several that we've gotten on how they plan to configure those, and that is a consideration. On the hospitals themselves, they do provide information generally on what they plan to do. Is this COVID positive space or COVID or general non-COVID space that we take into consideration? We haven't given them any direction at that point when we're issuing CONs, because they seem to be pretty alert on what they need to do as they congregate patients based on condition.
Well, Mr. Steffen, we thank you. Thank the commission for the work that you're doing in this unprecedented time. And I'm sure there are going to be some additional questions that come up. And I know there's a lot of interest around what happens to facilities that have not, that are only treating with COVID patients and have not had the other cases that they would traditionally. And this is probably a cost issue as well, but we will follow up in writing.
Yeah, thank you, Mr. President. I know Dr. Pollack was hoping that he could join, but his primary job pulled him away this morning. But I'll share his regrets on not being able to attend today.
Thank you very much.
Thank you.
All right, Madam Speaker, I believe we do have Department of Health.
Yes, hi, this is Greg Todd, Deputy Secretary for Operations for the Department of Health. Good morning, Mr. President and Madam Secretary.
Thank you,
Madam Speaker, I'm sorry.
That's okay. I knew who you were talking about.
Well, Mr. Deputy Secretary, do you want to go ahead and give us?
Go right ahead.
Okay, sure. So I wanted to just touch base. I know there's been a lot of discussion about PPEs and vents, and I heard some of the questions for Ben there at the end, so we might be able to address some of those with regard to surge. We are constantly on the DGS to procure. We've got probably 7 or 8 million different PPE items between surgical masks and N95 masks and gloves and gowns and all that go along with that are scheduled to arrive within the next week. Most of this is coming from China, so we are actively pursuing when we will be getting these in. We are also acquiring an additional 2,000 vents for the system. We have received 470 vents from the federal government. 50 of those are actually on loan to us from California, and I think it was a 3-week loan, so we have to send those back in 3 weeks. We just received those. and we are working on a vent distribution plan with MHA to make sure that the vents get to the hospitals that need them most. Aside from that, I will, on the surge side, Deputy Secretary and COO Schrader is actively working on that. We have, with regard to staffing, we have procured 2 different staffing agencies to help us staff up. Is doing the professional staffing, and the other is going to work with the students that we are getting out of the schools to help out with the clinical side. We are looking at the Baltimore Convention Center to get that up and running, and that will really be kind of the post-acute COVID patient location. So as they move through the hospitals and they need additional care but not ICU care, they will move there. And then the Laurel Hospital will be more of the acute care, the ICU care. And so I'll open questions. So what else can I tell you?
The question, I guess, the data from today, do we have any, the 10 o'clock updates, any trends from today's numbers?
I think we were an additional, a little over 500 new cases. So over the last few days, we've been in that 550 range for new cases, new positive cases. I was on the earlier call, but I apologize. I did not get to hear what the death count was today. I had a different call come in, so I'm not sure what that was.
It looks like the other question that we've heard is that the case count seems that we've had, the one day of over 1,000 new cases, which was a backlog of test cases. Then it was 700 and then 500, it looks like, for the last couple days. But it looks like the total number of tests that are coming in seem lower, or that the total number of tests are declining. Is that something that the Department of Health is tracking? Or I think we expected the test numbers to be going up, and it looks like it's gone from 2,500 a day down closer to 2,000 a day.
I don't have visibility on that, but I can check and see, what the trends are with regard to that.
Okay. It looks like we have a question from Senator Rosapep.
Thank you very much. And really, thanks to the health department. I think you guys are doing a great job. My question is, you talked about, it was good news in terms of we're getting ventilators, we're getting PPEs, et cetera. Do you have some stats and metrics for you to follow that we could follow on what we're getting in relation to the need? Are we at 10% of the need for ventilators, or are we at 110% of the need for ventilators? I just use that as an example.
Sure. I would say right now there are still, the hospitals still have a number of ventilators that are not in use. So I think at this point, we're probably safe with the ventilators. Now that could change over the next few weeks as the cases worsen. Like I said, we've got 470 that we've gotten from the feds, and we are going to, our plan was to hold 10% of those back for hotspots and distribute the rest of the hospitals. And we've been working with MHA on what that distribution plan looks like. So we'll follow up more with them today, and we can get those out quickly. So that's the ventilator side. On the PPE side, we are definitely behind the curve, only because we're having a difficult time getting them in.
Where do you think we are? Are we at 10% or 70% on PPE?
I'd say we're probably, given what we have in our stockpile, we're probably at half of what we need, and with what we have ordered, we're good. So it's really a matter of getting what we've got ordered in.
Thank you.
All right, other questions from members? So just as a clarification on that, while we're waiting for members who may have questions, it looks like over the last 5 days, we had 1,900, then 2,400, then 2,000, then 2,600, and then 1,800. So there's been this pretty substantial bouncing around. And I would imagine that's just the number of individuals who are seeking to get a test plays a role in that. Just not sure if that's capacity. Do the numbers on a daily basis that are being released of new cases and confirmed negatives, are those is that the full capacity of what testing is available that day, or is that more a reflection of how many tests are being given or processed?
Yeah, I apologize. I do not know the answer to that, but I'll find out for you.
Okay.
Okay, next we have Delegate Pena Melnick.
Good morning, everyone, and happy birthday, Mr. Speaker. I have a question regarding... I'm sorry, Mr. President. I am confusing my houses, but I love you both. Great leaders. In any event, I have a question regarding the federal funding coming in and the number of African Americans and other minorities and the need for tracing. Is some of that money that is coming in going to be given to the local health departments so that they can start tracing? I know that Anne Arundel County is doing a great job and they have a very aggressive program. Can you give us an update on that? I mean, this doesn't need to be studied. We know that there are disparities and we need to figure out where the gaps are in the 24 jurisdictions, and then what resources will we give to the locals? Can you give us an update?
Yes, thank you, Delegate. I appreciate that question. We have just, I'm going to plead a little ignorance here. I'm more on the operations side. So I've heard the tracing money that's coming in and the federal dollars, but I'm not sure what that allocation is yet. But I hate to keep saying this, but once again, I can get back to you on that question.
Okay. All right. Next up, Delegate Lukey.
Thank you, Madam Speaker. Could you speak a little bit to Maryland Responds and the Medical Reserve Corps and the extent to which we've met our goals in terms of volunteers who've signed up and gone through the course that they have to go through to become active members, and to what extent the state and localities have been able to put them to work?
Sure. So, we've gotten terrific response from volunteers through the MMRC. And at this point, we've got two projects we're really going to kind of focus them on. One is Secretary Rona Kramer at the Department of Aging is looking for some help, reaching out to in-home services. One of her concerns is that as more people become positive with COVID, those folks that have taken care of elderly relatives are not going to be able to do that now. So we're really looking at that MMRC to help us localize that response so that we can find out, what citizens need the additional help, and then we can team them up with some MMRC teams to get in and start providing them the care they need. We're also looking at, we mentioned earlier that we've got some staffing agencies to help staff up for the surge hospital beds. The volunteers aren't always going to be available to provide the type of hours and work that we need, but they will be very beneficial in helping, with regard to evening out that staffing. So we're going to start looking for them to help with staffing at the Baltimore Convention Center and some other areas.
All right, any other questions? If not, just one more question in terms of the process for contact tracing on the operations side. Will health be the lead agency for building out the contact tracing component of the sort of second phase of this?
I would assume so. That I've heard that we will be, but I don't know that for sure yet. So,
and have plans begun in sort of the hiring and recruiting of contact tracers? If I guess if indications from other states are anything of a guide, there's a big push to bring people on board to start training up to do contact tracing in a very robust way. Has that begun to your knowledge?
Not to my knowledge, but I do know that we have with the firms that we brought on, the hiring firms we brought on. I think when we get to that point, we might just be able to utilize them to help out. But to my knowledge, we have not yet.
Okay. Are there any further questions? It appears there are not. Well, Mr. Deputy Secretary, we appreciate your time and the agency's work in this crisis, and we look forward to following up and hopefully have an update next week.
Great, thank you. And like I said, I apologize, I don't have more answers for you at this time.
Thank you very much.
Yep.
All right. Madam Speaker, I believe we have the Attorney General with us potentially.
Yes, he's here. All right. Welcome, Mr. Attorney General. We're waiting to hear from you.
Thanks, Madam Speaker, Mr. President. Members, I appreciate the opportunity to be with you, even if remotely. You asked me to talk about price gouging. And let me say that since the governor's executive order went into effect, and that was authorized by your legislation at the very end of session, we've received hundreds of complaints about price gouging. And they relate to the items that I'm sure you're familiar with: hand sanitizer, toilet paper, diapers, face masks, many food items. We are using our regular consumer hotline to receive these calls. We have tweeted and posted and issued consumer alerts, trying to make sure that people understand that we are a resource that's available to help on this, and in order to make sure that we can put a lid on the price gouging that is going on. As I said, we've received hundreds of complaints. We've issued, I know, more than 100, I'm not sure how many more than 100, letters of warning to businesses that have been accused of doing this. And we've received responses from most of them. We are trying to give businesses several opportunities to avoid litigation. The first level of our addressing this is with our mediation unit. And if the mediation unit issues a warning letter and we get back a response that makes sense, nothing further goes on. But if the response doesn't compute, or if we have additional questions, or if we don't get a response, and that is very often the case, then we turn it over to our enforcement unit. And the enforcement unit follows up with a subpoena, ultimately with the filing of an administrative action against the folks who are accused of doing price gouging. Now, there's a difficulty with the executive order. We can't tell when somebody says these guys are charging $4 for a roll of toilet paper. We can't tell whether that's price gouging, and we can't tell for two reasons. Well, first, the executive order says that price gouging is an increase in the business's profit by more than 10%. And so you can't tell just from the price itself whether the profit is increased by more than 10%. But secondly, and significantly, perhaps from the legislative point of view, if a business wasn't selling toilet paper before the COVID crisis, then it can charge whatever it wants. Now, ultimately, the market, we hope, will take care of that when hand sanitizer, masks, toilet paper, etc., are more widely available and supply rises to meet the demand. It won't be a problem, but for the moment, it is, because we've gotten responses from some businesses that say, hey, we didn't start selling hand sanitizer until this crisis started. Strangely or surprisingly to me, one of the most frequent complaints relates to products being sold in gas stations, not the gas itself, but the products that that I just described: hand sanitizer, face masks, toilet paper. Many of those are being sold in the sort of mini convenience stores that gas stations have, and sold at extraordinarily high prices. And sometimes they can argue successfully that, hey, we weren't selling this stuff before, now we are, this is our price. And of course, you know, other folks say, and sometimes correctly, yes, our prices are high, but our distributors have jacked up the prices to us. And so we have to go back down the chain in order to figure out who's really responsible for the price increase, and to figure out whether we have the jurisdiction and ability under the law to bring an enforcement action. We are, of course, continuing to give advice to all of the executive agencies on how to deal with the crisis. We've been deeply engaged with the Board of Elections, with the Department of Health, with the governor's office in terms of establishing a legal basis for the executive orders. We continue to do will continue to do all of those tasks. The one other consumer issue that I think is significant, I'm sure you've gotten either complaints or communications of concern about this, and that is scams. Anytime there is a crisis, and especially now, the scammers come out and try to rip people off. So you can certainly refer your constituents to us for this stuff. But let me just say, if you haven't heard it already, that people are out there, and let me say this first. These folks, these scammers, are folks whose full-time job it is to rip off your constituents, you and your constituents. So they are doing it over the internet. They're doing it by phone. Rarely at the moment are they doing it in person, but we expect as soon as the isolation orders are relaxed a little bit, we expect to see them going door to door again. But we're getting complaints that people are selling cures for the COVID-19 virus online, over the telephone. Those are flat out scams. They're fraudulent. There is no cure at the moment. There may be drugs that ameliorate or sometime in the future cure the COVID-19 virus, not available now. And so anybody who's selling a cure is trying to defraud your constituents. People are selling or purporting to sell COVID-19 tests that you can take at home and mail in. Those are scams. Those are frauds. No such tests exist, as I'm sure you all know. People are selling masks, and those are often scams. People will pay the money, not get the masks. There is email phishing going on. Folks are posing as the Center for Disease Control, the World Health Organization, other health organizations and purporting to ask for information, personal information in the emails. They're also putting attachments on the email saying, check out this file, open this file, check out this link, open this file. If we're trying to get the word out, we're doing frequent tweets and posts about this, but tell your constituents, do not open those links, delete the emails. You can tell usually the return email has nothing to do with Center for Disease Control or WHO. And finally, and very significantly, there are scams around the government's issuance of checks and loans and relief of all kinds. People are posing as the US government, sometimes over the phone, saying, we can get you your check faster. We just need to confirm your social security number, or you need to pay us a delivery fee of $15 or $25 to get it expedited. Those are all frauds, and we hope people won't fall for them. I've probably used up too much time, but I'd be happy to answer questions that anybody has about those subjects or any others.
Okay, thank you very much. Our first question is from Delegate Sample Hughes.
Good morning. Thank you, Madam Speaker. And happy birthday, Mr. President. Attorney General Frosch, thank you for the guidance that you've provided on the, as it relates to the price gouging and the scams. What I did wanted to ask you, because I had inquiries from local officials where some of the businesses that are required to be closed based on the governor's order was still given a lot of pushback, even to and from law enforcement when they intervene, and then the local state's attorney was given threatening statements. But is your office providing guidance on that and giving warning letters, as you mentioned, as it related to businesses?
We're providing guidance, but we don't enforce those orders. The local, either the state's attorneys, the local departments of health would be the ones, or perhaps the State Department of Health would be the ones to be in touch and enforce those orders. If somebody is going to be charged, it would usually be the local state's attorney. I think I'd have to check, but I think we might have the authority to do that coextensively with the state's attorneys, but for the most part, it would be the state's attorneys who would be doing it.
Looks like we have a question from the President Pro Tem, Senator Griffith.
Thank you. Thank you, Mr. Attorney General. Always good to see you. And just a quick question. You answered most of my question when you were talking about the fraud and scams. I wonder if you're collecting any data in terms of the information that's being reported, so that in the after action, as we look back, we'll be able to kind of track whether or not there are trends. The other thing I wanted to ask is if you have someone that could put together a sheet that we might, and you may already have it, that we can send out to civic and community leaders and constituents with some of the common actions that you're seeing happen, some of the common activities that are being reported to your office, so that we can kind of get these messages out, because you said a lot, and I want to make sure that we're able to capture it and communicate it back to our communities.
Just on the second question first, Senator, yes, we can send you a list and description of the different scams, the different types of price gouging, and we'd be happy to do that. And now the first question, yes, we're keeping track. You know, we're challenged as everybody is during this crisis. Our mediation unit is usually staffed by 60 volunteers. They volunteer 10 hours a week, 2 5-hour days, come in, field phone calls. We get, 30 to 40,000 phone calls a year. The volume is not diminished, but we don't have our 60 volunteers. The way we've kept our noses above water is to ask for volunteers within the office, because some folks who are working for some of the executive agencies aren't as busy as they would be otherwise. And so we've gotten, I think, more than 50 lawyers in our office who volunteered to pitch in on price gouging. But we are keeping track of all the complaints and all of the actions that we're taking in response to those complaints. And yes, there will be information available for review after things calm down, and probably while they're going down. But I think we're gonna need a couple of weeks to get on top of that.
All right, I don't see any other questions. Mr. Attorney General, this is slightly different. Questions come up in the last couple days that this is going to be sort of catching off guard. So to the best degree you may know, the executive order around essential businesses, the categories are outlined by the executive order. And the administration has provided a decision tree chart for businesses to sort of self-identify and kind of exercise their best judgment. The enforcement has been authorized to the locals, the health departments and law enforcement agencies in the locals. And there are several businesses that sort of fit into a gray zone. Could be, in some cases, are essential, and in full operation may not be entirely essential. And when they've been looking for guidance, it's been a bit unclear whether it's the interpretation of the enforcement agency of the executive order or that independent businesses' own interpretation of the executive order. Is there, do you have a sense of the legal operation of how a business could know whether it falls into a category and who has enforcement interpretation preeminence?
Yeah, I mean, the interpretation, the governor's office has been issuing guidance for interpretation. Now, it may not have gotten down to the granular level that a local business needs in order to make a determination about whether or not it's essential. But I would think, because of the delegation to the local departments of health and state's attorney's office, that the first place to check would be the local Department of Health. And if they need additional guidance, then State Department of Health. And if it's a broad enough question, or even if a legislator wants to know whether a particular type of business is essential, they can ask us for advice, and we'd be happy to give it.
Great. Excellent. Thank you. I don't see further questions. Madam Speaker, do you have it?
Yeah, but I don't see anything further.
Well, thank you, Mr. Attorney General, for the work. I know this has been chaotic in your office as well, trying to manage all of the questions that have arisen. And want to appreciate you and your staff for being so responsive for all of the things that have come about. And we're really appreciative for your team.
Well, the appreciation is mutual. You guys are doing an outstanding job and in incredibly difficult circumstances. So thank you.
Thank you.
Thank you.
Madam Speaker, we had, I know that the Chancellor was not able to join until 11:10, so we have a little 5-minute break, moment in time. I thought maybe we could potentially, some of the open comments that we were going to have at the end, maybe shift those up. Yeah, does that work? So one issue that I know has come up from several members of the Senate is this sort of question around phase 2. The executive has been very focused on the emergency, which makes absolute sense of how to move forward on a day-to-day basis, managing the crisis, the surge capacity, kind of getting pieces in place. We had a representative from the health department. And I will say I was a little bit disappointed that while I appreciate very much the agency's work, I was disappointed in the lack of clarity on some of the steps that it will take. My general sense is that in order to move forward, we're going to have to have a robust testing, contact tracing, and quarantine program in place. And I'm sure there are people in the health department that are working on it, and was hoping that we would get a bit of an update today. But this has come up because I know that there are a lot of businesses that are not just businesses, but individuals have been wondering what phase 2 looks like. And this conversation around the states coming together with compacts has certainly bubbled to the surface as something that wondering where Maryland is in this process. And there was news about Maryland, DC, and Virginia. Senator Jennings, I know that there was an issue you wanted to bring forward, and wanted to see if we could maybe raise that to the attention now before the system joins us.
Well, sure. Thank you, Mr. President. It's not necessarily an issue. It's just, as you said, phase 2. What these conferences have shown us over the last 3 weeks is that the administration and the governor have done an incredible job getting us prepared, putting the infrastructure in on the healthcare side to make sure we are ready and capable as this thing spikes. And it appears that also we have somewhat flattened this curve. What's next? We can't continue this forever. We will have to open businesses. And just as quickly as we shut business down, we can't open it up that quickly. And I think we need to start to take that step, looking at, this work group. What is its foundation? What's our purpose? I think we can maybe step into that arena and start to figure out, working with business industries, healthcare, the professionals, saying, hey, what's it going to take? A month ago, social distancing was a joke. Nobody thought it would work. They didn't understand it. But now it's second nature to people. You see people talking, standing 6 feet away. If they're in a store, they're standing, away from each other. They're using hand sanitizer. So I think as we move forward, our purpose should, or at least a subset of this work group, should start to look at what's it going to take to slowly open business up, because there are some businesses that might not be considered essential, but I do think they still serve a purpose that, should be open and working. And I don't want to get too far out front on this because we are still dealing with the pandemic, but I think we as a work group need to take that step and start working there and part of it is giving these business owners and these people hope that, yes, there is light at the end of this tunnel.
And I want to point out, it's not just a concern on the Senate side.
Yes.
Members on the House side also had expressed some of the same issues. Where are we going, in terms of time frame that's safe enough to do. So.
Absolutely.
Thank you, Gada.
Are there other member comment, thoughts, considerations? Senator King? Oh, one moment, we're just make sure that there we go.
Okay. And I really just don't have any answers for people. I have a lot of teachers in my area that are wondering, as far as planning for, will they go back into school this year? Will it be September, whatever? They're just looking at the immediate future, especially special education teachers, trying to make plans with students and meet with students online, which is really hard with special ed students. Any kind of, the State Board of Education, I understand, did not make a decision yesterday about going past April 24th. I'm assuming we're still not looking at opening after April 24th real soon. Correct?
Unfortunately, your guess is as good as mine at the moment. I thought we'd hear something as well. I think, certainly there are a lot of factors at play, but your assumption is sort of the working assumption that I have as well.
Okay.
Madam Speaker, have you heard any differently one way or the other on schools?
I just thought that April 24th that date was gone, but I haven't heard anything more, when it would be, because I think that when the superintendent, I think that she has to get back to in discussion with the administration in terms of before something is said that may not be exactly accurate. So. And I see that Delegate Jackson has his hands raised.
Speaker, thank you, Madam Speaker. You know, in light of the school updates, I think many of us are hearing the same. Our broadband challenges that the General Assembly has looked to address over the last few years. I'm wondering if anyone has heard any updates from the school board regarding that, on ensuring that our, if this distance learning is going to be extended, to ensure that our students have access.
Something that we have to definitely get definitive answer on, and we will share that with the work group once we get it accurate. So.
Looks like we have, I see that Patrick Hogan has joined us. I believe that I don't see the chancellor quite yet, but Senator Rosa Pepp, I believe, has a comment here.
I just want to say that I don't have any new information on the school question or other ones, but it seems to me it just reinforces what Senator Jennings said, is I think it is now coming close to time where we need to be working with the administration on the recovery plan. So I just wanted to second that.
Yep. I think that certainly is, we've hit an interesting part of this, and obviously public health is the most important. But being here as a homeschool teacher, the question of how long it goes and how far, I will say, and Madam Speaker, you and I have spoken about this, the just deep concern about what the educational impact will be of the closures. It is important that we make sure that public safety is public health is number one. But you know, we know that there were existing divides in educational outcomes as they were in the system when it was fully open. We're going on a full month now of closed schools, and we know that there are far too many kids who have not had access yet, and you know, there are teachers who are trying really hard, but we have some serious recovery work to do after this on the education front.
There's quite a bit have and had not, as it relates to the laptops for the students. And,
absolutely. The basic foundational stuff.
Yeah, to be able to catch up. And I know a lot of the, like in Baltimore County, the materials and assignments being sent, and they're also using Zoom for their classes, but it's not everywhere. So it's a problem that we as a state, you know, face, and it's just the reality. And we're in the 21st century, so. But who knew that we would have this pandemic happening now? So who could have thought that? But this is what we're in. So. Agreed. Yeah.
Madam Speaker, it looks like we do have the
Delegate McIntosh.
Oh, sir.
Thank you, Madam Speaker, and thank you, Mr. President. And I want to add on to what the Speaker just said and what President just said. Not only should, you know, have many of our schools been very challenged around being able to reach students to actually continue learning, but I do think we ought to give a pretty big shout out to our schools. Our schools have also been really in charge of feeding their students and now feeding those students' families. And so, you know, the schools in many of our areas, all of our areas, have done a great job around that. And it has been, I will tell you, from the Baltimore City perspective, it's been probably the #1 focus of many of the people in the school system is to actually distribute food as well as learning packets and so on and so forth. But I just wanted to add on that shout out, kudos to our schools.
Thank you. Well said. Okay.
I believe, Madam Speaker, we have the Chancellor, who is on mute. If we could fix
I got it.
There we go.
Sorry.
That's okay. You're here.
Happy birthday, Mr. President.
Thank you.
Can I start?
Yes, please.
How do you do, Madam Speaker?
I'm doing okay, Mr. Chancellor.
Thank you. Let me start with matters related to students. The system universities began remote instruction beginning March 23rd or shortly thereafter in a few cases. And we are working with the faculty, even though it's gone incredibly smoothly for such a quick turnaround. We're working with the faculty with webinars, virtual workshops to help faculty who, in some cases, in many cases, have not had a great deal of experience with online and distance learning to get them to optimize what they're doing. The feedback is largely positive. I was just on the phone with the faculty senate chairs from the various institutions. The reports are very good, ditto for the students. I'll come back though to the challenges we need to be mindful of with regard to students who are maybe not in circumstances where they can easily avail themselves of online teaching. Summer sessions, we haven't made a final decision across the system, but the institutions are prepared system-wide to continue remote instruction during the summer. And the preparation will obviously be less arduous than it has been this spring. I think you're all familiar with student fee refunds. Every system institution is refunding on a prorated basis the fees associated with room, board, athletics, parking. Universities have discretion about other assessed fees, but those four biggies are baseline for every institution. And the universities have sent letters to their students specifying which fees are being refunded, the basis for the proration, and a timeline by which students can expect to see the refunds. Many of the refunds have already been made or are being dispersed now. I made a comment just a moment ago about needy students. Most system universities have had an existing pool of money that they draw from to help students in need. And obviously those reserves are being stretched. So there has been a great deal in the way of fundraising. And the foundation of the system has put up money for each of the institutions. We estimate that about $1 million has gone to USM students who are in need. But then there's the technology assistance piece, which sort of highlights the what some people call the digital divide. People who don't have adequate technology, they can't afford it. Computers, software, internet connectivity, they're obviously terribly disadvantaged. So again, the institutions have put up money to address the support of students in need of technology. We're very sensitive to that. There are loaner programs. One of the institutions has set up a hotspot in one of the parking garages so that students can come there and work and still be compliant with the social distancing matter. We are very sensitive to the fact that not everybody can simply roll over and be ready for this new technological world. Still staying with student issues, we've organized the option for pass-fail grading, incomplete grading, recognizing that there has been a change in our instructional methods. Students have until the last day of the semester to decide whether they want to take a letter grade or whether they would be more comfortable with a pass-fail grade. We're also counseling individual students who are applying to a professional school or to certain graduate programs about the wisdom or lack thereof of taking a pass-fail grade versus a letter grade. But again, lots of options for the students, up to them, given this pivot that we've had to make in the way we're instructing. Turning to admissions, getting the class in for the fall. I think you know that the ACT and the SAT administrations have been suspended, and therefore we have suspended across the institutions our requirements that students have one of these entrance exams done in order to get into one of our institutions. International students, study abroad students. First, the study abroad students. We think we have everybody home except those who made a conscious decision that they're better off where they are and are staying overseas. And we've also ensured that our international students living here are in stable environments. Some of them are still in the campus environment, certainly at least in off-campus housing. We're sensitive to the fact, again, that not everybody can go home. When the governor issued the stay-at-home order on March 30th, that, yes, interrupted some of the move-outs in dorms. Some institutions had virtually completed the dorm move-outs. You may recall that when we first got into this in maybe March 9th, March 10th, the intention was that after spring break, we would have the students not come back for 2 weeks, essentially to have some sort of quarantining after they came back from spring break. And then the world changed again. And it wasn't a matter of just 2 weeks. It was a matter of teaching out the semester at a distance, and therefore the dorms needed to be vacated. We have generally been able to accommodate students in various ways. If there was a student at Coppin that had left some meds in his room, obviously exceptions are made. But for some of the students where they didn't get scheduled to come back and evacuate their dorm room, some of the schools have actually engaged vendors who come into the room, get the student online so that the student can work with them and see what they're doing in packing up their stuff and then sending it to them. So I think by and large, the campus move-outs have worked out well. Obviously, no in-person commencements for the students, big takeaway for them. None of us would have wanted that to happen to us after a lot of hard work, families looking forward to it, but that's the reality. The campuses are working with their students, asking their student governments, what would you like? Would you like a virtual ceremony? Shall we just forget the virtual and try to do something in the fall or the winter? There are various plans in place, but those plans are being created in concert with the customer, the client. Who is it that the event is for? Employees. You know that I've deliberately used the language, the campuses are open, because we are continuing to teach. And there is some critical research that is going on, research responsive to the very crisis that we're in. So there's got to be some degree of essential employees. We've severely curtailed that number. We believe that they are working in safe environments. And I've constantly held as an expectation of the president's that we have no employees on campus who are not absolutely required to be there. I think we've got it down to the bare minimum across each campus. Obviously, the needs vary. We've tried to be attentive with regard to communication with AFSCME to share information on a number of issues which they've raised. Again, I believe that we have done everything that is expected with regard to making sure the employees are safe in their work. Speaking of employees, we obviously are aware of budgetary issues, and each institution has taken some action ranging from a very high level review of any hire that is made to just a plain old hiring freeze. That's already in response to the constrictions on state revenue. I'll come back to budget as I finish up my remarks. I do want to point out that we can all take pride, and we should expect that the system institutions are not only going to be responsive to the crisis in terms of educating and in terms of treating people properly, but we're actually across a number of the campuses involved in responding to the issue itself. Number of our universities and affiliated companies are fabricating and donating PPE, life-saving gear, whether it's N95 masks, face shields. There's hand sanitizing being manufactured at one of our campuses. Our faculty have contributed to the so-called geospatial modeling around COVID-19, so we know who's moving around, and that data, I think, is very useful to the public at large and to decision makers. Some of the faculty are working on creation of simple ventilators. I think you know that the state is working with the School of Medicine at UMB to ramp up COVID-19 testing with a $2.5 million infusion of state funds. The medical school is launching large-scale testing, which will, I think in a reasonable period of time, allow 20,000 tests per day. I would also mention, with regard to the healthcare response, that the system has asked each university to issue an urgent call to retired health professionals among their alumni to help us address the crisis. We're linking alumni to volunteer and paid opportunities within the state. I am also pleased to report that the system's current health profession students are permitted to volunteer. We graduate across the system 4,000 health profession students every year, and many of them are engaged in the fight, if you will. And to put a finer point on it, we've worked with the professional licensing boards, the Board of Nursing, the Board of Social Work Examiners, and we have flexibility for students who want to do it to essentially graduate early. They'll get their degree in May along with their class, but they are allowed in appropriate environments to get started in the workforce early, and that has happened already. University assets for state use. A number of the institutions have been asked by the state as well as local jurisdictions to make university assets available for their own use. And residence halls can be used for first responders and medical personnel housing. There's been some discussion about open spaces that can be used for staging or storage of supply and distribution. Shuttle buses maybe can be used for transportation. At any rate, we're open, obviously, to all of that. And we've developed an MOU template that the institutions can use in order to formalize these arrangements. Budget.
Chancellor, I know we have a couple questions. Just want to make sure if there are any sort of final concluding points before we jump into questions.
I was just going to wrap up on budget, Mr. President, and tell you that because of loss of revenue and additional operating expenses, we're probably going to complete the semester about $230, $240 million behind. That's our estimate, and that's just through the end of the semester. We're looking forward to the relief from the CARES Act, but obviously it's not going to be enough. Thank you.
Thank you so much. I suspect on that point, we may have our first question might be digging into that. The chair of our Budget and Taxation Committee, Senator Grisoni.
Thank you, Mr. President. Nice to see you, Mr. Chancellor.
Good to see you.
So yeah, I was actually, you answered part of that already. What about long-term planning? Have you been developing a number of scenarios? What can you tell us about that?
Yeah, so again, the number I gave you, which is a considerable number, is just through the end of the school year. We know that we're going to need to manage to a number. And we are cognizant of the fact that salaries are our largest expense. That's why we're being very careful about adding any incremental personnel costs now. And we will need to use the various tools in the toolbox to the extent that we are forced to reduce expenses.
How much flexibility do you have in your reserve funds right now?
We have reserve funds and they will help us to get through this immediate issue. They won't cover all of it, but you use the word flexibility, and that's where there's limitation.
Yeah, I know that you use them for long-term planning on other issues. So yeah, things might need to change.
Thank you, Senator. Appreciate it. Thank you. Thank you, Mr. Chancellor. I don't see any other questions. Madam Speaker, do you see any other?
Not on our side. Nope.
All right. Well, I know we've gone a bit over. Mr. Chancellor, thank you for your time. Thank you for your efforts. I know this has been complicated on the system's behalf as well. So we thank you, and we may follow up with some written questions, but appreciate your time today and the work that you've been doing for the state.
Thank you for your support. I appreciate it.
Thank you.
Right, Madam Speaker, I know there were two senators that had some other comments before the Chancellor jumped on. If it's not a problem, if I could call on them before we conclude.
Sure.
First off, we have Senator King, I believe, had a comment.
Yes.
Go ahead.
Yes, I do. I've gotten a lot of different phone calls from childcare providers. I'm sure many of you have too. And I've spoken to the president this week about urging the governor. And, there's a $3.5 billion grant for childcare and development and child development. And we would like to try and get part of that grant. When we look at opening the world back up again and getting people back to work, one of the most critical things is going to be childcare, because that's number one on so many people's list. They can't go to work unless they have their kids taken care of. So I just think it's something we need to really have on our radar.
Oh, hold on one second, Senator King. We lost you midway.
You muted me.
Sorry, I don't know what happened there. Go ahead. I'm sorry.
I just think it's something we have to have on our radar screen. That's one of the first steps we have to look at is childcare for our people that are employed.
Absolutely. It's going to be a crucial issue. Thank you so much for bringing that up. I think that's something we're going to have to dive more deeply into. Thank you. Senator Hershey. If we could just get Senator Hershey, there we go.
Yeah, thank you, Mr. President. I just wanted to follow up on some of the earlier conversations about the recovery in the economy. Obviously, we're seeing in the news now that other states are beginning to discuss recovery plans and developing blueprints or checklists to ease isolation restrictions on citizens and to find ways to phase in the opening of these businesses. But honestly, it doesn't seem like Maryland's taking any steps towards that recovery yet, although I do see the governor's holding a press conference today. So hopefully we'll hear something from him today on it. But I think it's important for us as a work group to maybe begin hearing from economists or job creators, maybe business coalitions that can advise us on some of the long-term ramifications of a shutdown, and maybe even more importantly, to start hearing about some of the uncertainties that businesses are facing due to not knowing when they'll open up or if they're going to open up. This is really just as much a plague on our economy as it is a health pandemic. And understandably, the focus has been on protecting the spread of the virus, but I just can't emphasize enough that it's time we start looking forward and start talking about economic recovery. And I'm hoping that under the leadership of you and the speaker, that this work group can help lead some of those efforts. Thanks.
Thank you, Senator. Certainly seems like a right place of action moving forward here. What does phase 2 start to look like here?
Did I?
It looks like I could see in the video, but not a hand raised with Delegate Grice.
Yeah. All right, Delegate Grice.
Thank you, Madam Speaker, Mr. President. Yeah, I just want to just add to what Senator Hershey and some of the others were saying. And I think the intention, with sort of this isolation and social distancing was to make sure that our healthcare system wasn't going to be overwhelmed. And no one's really, explained to us or this group whether or not we're seeing that. And the sense that I have, and I don't know what the rest of you guys, is that that our healthcare system seems to be absorbing this okay. It seems to me that we should at least start having this conversation. And I'm hoping that within the Department of Health and certainly in the governor's office that they're already starting to have this discussion too, because as many of you all know that, we talk about spending all the time, and sometimes it's a point of contention, sometimes it's not. But I think we can all agree that both federal, state, and local government, there are very, very important roles that we play. And a lot of the people that work for government, they're not going to do it for free, and we can only sustain this for so much longer. And it's the private sector, it's the taxpayers that, their income taxes and their property taxes largely, and sales tax that pay these salaries, these important salaries. And I can't imagine, a time when we have to start laying off, or we have to start, not paying, essential government workers too, and I don't know how far along we are from that too. And that's another answer I think we should probably get, and I know that we're going to hear from the budget secretary pretty soon. But I think the collateral damage from this could be as bad or worse than the virus itself. And just looking at the sheer numbers and the small percentage of our population that's experiencing the virus, firsthand, obviously it could be a lot worse, and that's what we want to prevent. But at the same time, we also want to prevent total economic collapse. And there's some things that we're hearing, at least on the shore with the agricultural industry, that we're very concerned about. We're hearing about, the out in the Midwest, beef production is getting shuttered. Smithfield is shutting down their plant. Our poultry integrators are shuttering down too. They're eliminating entire shifts, and what they're doing is they're going into a lot of these chicken houses, and they're actually they're killing chickens now because they're not processing them. The problem that we have is we have farmers all across the state that are paying, right now, hundreds of millions of dollars, to plant crops and to fertilize and get everything ready. And at the end of the year, come fall, if they don't have a buyer, and potentially they couldn't because we're shuttering so much production right now, that they could just till all these things over. And what that's going to end up meaning, though, is that we're not going to have food on the shelves for people either. So I think, I don't want to be a doomsday. I'm not that kind of person. I'm not, I usually try to be optimistic, but I don't want to position ourselves where we're going to be in that situation. And so I do think that, we have to be careful. We rely on our society to be productive and produce things, and we can't sustain, our society to sit back and on the side of the lines and just watch. They have to be productive. They have to work. So this is important.
Thank you. We also have a question from Delegate Pendergast.
Accept that is a real issue, but I really want to make sure that we maintain caution and balance. I think something was said that was right on target. We've done a good job of making sure the hospitals can keep up with the illnesses. We're managing to not overwhelm facilities at this point. But I think the reason that's happening is because the citizens of Maryland have been remarkable in social distancing. I know that when I take a walk, everybody moves 6 feet away, whether it's me or the other person when we pass. When my husband goes to the grocery store, people are wearing masks, both the people behind the counters and also the customers. It's now rare to see a person without a mask. These are really important issues, and we have to keep focusing on social distancing, because as much as we're flattening out the curve, if we stop flattening the curve, at that point we spike, and that creates the problem with the medical facilities. So I agree that we need to be thinking about planning, but let's not confuse the message for people who are listening to this, that we're ready to open up, that we really need to keep that curve flat. That's all.
Fair point. Well, I think that is all the hands raised. So I guess if we were moving into concluding remarks, Madam Speaker, just one thing I forgot to mention at the beginning of the meeting was that we are, there's been a lot of questions about Zoom and platforms, and the Speaker and I have been discussing the platform itself, and so we're evaluating all of the options. If there are any updates or changes, we'll be sure to let the work group know as soon as possible. But just wanted to let work group members know that that's where we are. The other was that I believe Delegate Grice mentioned the budget secretary who was invited for this meeting and was not able to join. And so, we're hopeful that we'll continue to have robust participation from the administration moving forward. But just want to thank all the members. This work has been really, really complex and hard, and the legislative branch's role in this has been something that we're all working forward, and understanding, to Delegate Pendergrass's point of the importance of public health being the foremost, and then several of the senators' points and others about making sure that we have what does phase 2 look like? What does a recovery look like? It really feels like there is a clear policy space for the legislative branch in that, and making sure that Maryland can recover from this because we will, and that we have to be strong as we do. So look forward to the ongoing discussion. Madam Speaker.
Okay, thank you, Mr. President. Just wanted to let you two things. The first is that I've directed our staff to follow up with the Maryland Department of Health for more details about the plan to fill the other 50% of PPE needed for the upcoming weeks. And once we get that information, we will share with the work group. And the second, previously you were told there would be a meeting also tomorrow. In light of the fact we went longer today and we were able to combine what we were going to discuss tomorrow today, there will not be a meeting tomorrow. So with that, I just wanted to thank everyone for their actually able to stay a little longer. We're going on about, it's going on about 11:45 now. There was good comments that and suggestions that were put forward, and there are some that in which you will be receiving follow-up in writing for some of the questions that didn't wasn't be able to ask by the member, not the member, about the what's the guy's name?
Deputy Secretary.
Deputy Secretary, yes, from the Deputy Secretary. So that's what initially. So we'll be getting that to you. And I thank you for your time, and enjoy the rest of the week. Stay safe, and thank you for all that you do.
All right, thank you.